This morning on The New Normal, we want to answer your questions about the coronavirus vaccine. As we've been reporting overnight, the FDA granted Pfizer emergency use authorization to distribute its vaccine nationwide. Dr. John Torres is here with some important information. Dr. Torres, great to see you. I want to jump right in because we do have a lot of questions. So the first one comes from 90-year-old George and 75-year-old Suzanne of Maryland. They ask, how will we know we are eligible for the vaccine? Does our primary care physician call us, or do we call them? What's the answer here?
And Kristen, good morning. These questions are always fantastic, and this is actually one I'm getting a lot of because people want to know when they're eligible for it. The CDC came out with their criteria, but that criteria could vary state by state. The CDC is saying initially, at least in the first wave, healthcare workers, essential workers, those at high risk, including those in long-term care facilities, and then they're going to work down the list to those 65 and older. Some states are varying that, shuffling that around a little bit, but the main thing is you're going to find out information from your doctor's office and clinics, hospitals. They're going to start texting and calling people, letting them know when their patients are eligible. You're also going to see advertisements and maybe public service announcements, so certainly listen to your local news. And if worse comes to worse and you're certainly not hearing anything or simply not hearing anything, call your doctor's office. They'll know.
Okay, that is good. Now, this next one, I think a lot of people are going to have this question. This is from Rashad and Imani from Brooklyn. They ask, will this be a one-time shot or something we will need to take annually like the flu vaccine?
Right now, this looks like when you get the shot right now, it's actually going to be two shots. You're going to get one day 0, and then 21 days, 3 weeks later, you're going to get the second shot, the booster shot. And then after that, what we're going to determine is how long this shot will last. We think it's going to last a few years. It's not going to be like the flu shot, at least initially, but researchers have to look at it. They have to follow people who got the shot. They have to follow the virus to make sure it hasn't changed. But so far, since the beginning, the virus has not changed that much, which means researchers think it can last a few years, hopefully even longer, Kristen.
All right, let's talk about folks who are dealing with allergies. Karen in Florida asks, I'm allergic to penicillin, so how long should I wait until we know more about the side effects and who is or is not eligible based on their allergies? And adding on to that, will any medications interact with the vaccine? What do you think?
So to start off with the last part of that, medications will not interact with the vaccine because they work on two different levels, two different ways in the body. But the emergency use authorization the FDA just came out with, they said the only people for the authorization that shouldn't get it are people that are allergic to certain parts of the vaccine itself. Now, the UK, we had a couple people that had severe allergic reactions, so they're putting a little more stringent standards and saying nobody with any severe allergies. But penicillin allergy, which typically tends to be mild to moderate at most, that should not preclude you from getting this. The CDC is going to meet today or tomorrow over the weekend and give us more information and more of recommendations on how to use this. And so I think they're also going to address this and give us an idea of who and shouldn't get it. But for the most part, if you have a penicillin allergy, it should not preclude you from getting this.
Okay, and very quickly on this last one, Dr. Torres, Sarah and Eric in New Jersey ask, when will my 1- and 4-year-old kids be able to get the vaccine? Parents everywhere want to know that.
And that's the big question. Right now, the emergency use authorization, 16 years old and above. They are studying 12 to 17-year-olds. Pfizer is. Moderna is going to start studying them as well. And until we get more information on this, they won't start really studying the 1 to 4-year-olds or the 0 to 4-year-olds at this point. So what they're trying to do is school kids, get the shot to them this summer, so when they go back to school, they're protected. It's going to be a little bit longer for those 1 to 4-year-olds, though.
All right. Parents are going to be thrilled to hear their kids can go back to school. Dr. Torres, thank you so much.